Hello, I think I am live. Hopefully, somebody will send me a little bubble to let me know that you're hearing me loud and clear. I'm Caroline Clark, and I'm going to be taking questions. Oh, yes, somebody's saying hello, 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 Rosie, hello, Nicola. That's great. So, yeah, I made it. This is my first live Facebook chat, so it just seems quite strange chatting to a camera, but it's lovely that people are coming in and saying hello. So thank you ever so much for that. I'll just hang on for a few seconds before I launch into any information giving. But you've probably already seen on the Facebook adverts that I'm Caroline Clark, and I'm a proud APBC full member and a clinical animal behaviourist with the ABTC. But also I'm a veterinary nurse, and that's sort of where my life began. That's where I'm rooted, still involved very much with veterinary practice. It's something that's quite close to my heart. And as a behaviourist, one of the things that I'm quite passionate about, to mix with the veterinary nursing side, is to help animals and to make the experience for them as stress-free as possible, or as low stress as possible. So it's lovely. We've got other people coming in now. So yes, hello, hello, hello. That's nice. It's lovely to see that people are actually there. So yes, sorry, going back to a little bit about my sort of life as a behaviourist, and that's a changeover from veterinary nursing. The two really marry well together. So yes, tonight I'm hopefully going to be able to share my experience as a vet nurse and a behaviourist, to help people and to help people who are working in veterinary practice to perhaps mitigate some of the stress that animals feel naturally when they're in a veterinary environment, but particularly at the moment with the restrictions with COVID, because the owner can't necessarily go into the building. Vets are resuming a little bit of more of a full service than they did a few weeks ago. So some vets will allow clients in one at a time, but the nurse has to take the animal and restrain it during an examination. So the primary caregiver isn't there with the animal, and sometimes that affects the owner perhaps as much, and sometimes if not more, than the animal, because they feel quite stressed about the fact that they can't have contact with their animal. And we can't forget that obviously the energy of the owner we have to take into account as well. So it's being aware of not just the animal, but also being aware of the owner. So we've got a few more people in, so lovely, thank you for coming and saying hello, and yes, that's great. So I don't think I've got any questions yet. So I'm just really thinking about some of the things with the COVID situation at the moment. One of the main things that I think animals might feel dogs and cats primarily we're talking about tonight, but generally animals might feel a little bit stressed about or alarmed about, is some of the PPE, the protective equipment that the vets are having to wear, the masks, the gloves. The gloves being latex smell quite strange, and obviously the masks are covering the animal's face, the veterinary surgeon and the nurses' faces. So that can be quite alarming. And so one of the things that as owners and as professionals, what we can be telling owners to perhaps do a little bit of, is habituating their animals to masks. And I've got a prop tonight. But yeah, it's quite alarming and it's quite alarming for us, I think, sometimes, if suddenly you see somebody with the face obliterated or part obliterated. And the thing that certainly with dogs is there's been some studies to show that it's the sort of the middle of the face, so it's the eyes and the mouth and the nose. So if those parts of the face are covered, then the animal can't always get an angle on what the face is demonstrating. And we've got to be a bit careful as well, because because if all they can see are our eyes, then we know that a lot of animals don't really like being stared at. So I think from a professional point of view, we have to be aware of that, but also from the owner or the carer of the animal, perhaps might be as well to habituate them to masks in the home. And that needs to be done quite sensitively. So, we're wanting to do it in a very sensitive and slow, gradual fashion, pretty much in a similar way as if we were maybe muzzle training. So we would have the masks close by while the dog's being praised, while the dog's being petted, while we're giving them treats, so that it's very passively in the environment. They can see it. We're not going to push it into the face or anything. And then once they're sort of seeing that there, we can maybe move it a bit closer still, and then pick it up and let them sniff it. So that they can see it, and then we might just pick it up, and then gradually we might present it a little bit nearer to our faces. So we're taking our time in actually getting it on. We're not going to put it on all of a sudden. So yeah, the idea is just to habituate the pets to seeing these, so that when they go into the veterinary practice, it's not a big shock to them. And they can do exactly the same with gloves as well. So that's something to bear in mind. And I know there's at least one veterinary nurse with us tonight, because I can see a name there, Laura, hello. But those of you that work in practice, again, it might be worth, obviously some owners won't know about that. It might be worth perhaps on social media giving them some advice about that. The Dogs Trust have produced a really nice poster, and that was on the APBC website, so it might be worth having a little look, website and Facebook, so it might be worth having a little look on there, and then you can maybe reproduce that in the practice and just spread the word out to clients. So yeah, that's something that I thought might be certainly worth mentioning from the onset. So I'll put my prop away now, but hopefully that's just demonstrated that a little bit. So have I got any questions yet? Not yet, I don't think. No, there's nobody coming out with any questions yet. But please, if you have got any questions, please do ask them. I do know that the video is going to be saved. So if you have to leave early, hopefully you don't. But if you do, it will be in the archive somewhere. And also, if you want to just go back on anything, you can, or tell friends about it. Please do. So yes, what else have I thought about? Yeah, I think the problem as well at the moment is, particularly for those practices that are just taking the animal from the owner in the car park, I think although it's not necessarily exactly behaviour, it's certainly health and safety. Do beware, as a veterinary nurse, I've seen it lots of times that people will bring a cat in a carrier and not fasten the fastener properly, and somebody picks it up, and being in the car park, very vulnerable to escape. The same with leads and collars. That's really something that we need to make sure that they're not going to slip out of the collar. And that's certainly something that I'd be really aware of. So yeah, just keep an eye out on that too. One of the things that I think helps a lot before any engagement with an owner in a veterinary practice, and actually I do it as a behaviourist as well, is that I always spend a little bit of time chatting to the owner first of all, and that might be a really good idea before we whisk the animal away from the owner. This is generally more so perhaps for dogs, because they're seeing that engagement. But if when we were exchanging the dog in the car park, or even in the waiting area, and then we're taking the dog into the waiting room, I think it's a really great idea to chat to the owner, because that sort of makes the owner relax, and in turn makes the dog relax, because if they're seeing that this other person is friend, not foe, then they're more likely to go with that person and be led off with them. And using that sort of upbeat, cheery, sort of jolly along type voice as a vet nurse, those of you out there that are working in practice, is a really good idea. You know, come on then, off you come with me. You know, that can help a little bit. So that's something I think as well to bear in mind, and it just settles the owner down as well. If the owner is allowed in the consult room, obviously with that distance between them and personnel, it might help if the dog or the cat can see the owner. If the owner can't hold them, then at least they maybe be able to see them, and that might help. Certainly, perhaps more so for dogs, but to a degree, yes, for cats as well. So that's, I think, something to be aware of. I think for cats, it's a really good idea to make sure that the owner has got some, again, in a veterinary environment, it might be worth putting this on sort of social media. Put lots of towels in the carrier so that the cat has got somewhere to hide. Cats like to hide, it gives them a sort of a sense of security. So if they've got somewhere to burrow underneath, it might make them feel a little bit less stressed. And also, if we are carrying the cat from the car park through into the practice, or in any situation, covering the crate, the carrier is really important, because again, cats gain a sense of security by being hidden, not feeling that they're being stared at, and certainly there's that sense of, if you can't see, if I can't see you, you can't see me, so it just gives them that bit of security. So that's definitely another thing that I would be advocating for owners to do. Bring along some towels, put them in there, and perhaps one of their own covers. In a veterinary practice, you can have a pile of towels that are clean, perhaps sprayed with Feliway Classic, but I do think cats derive a sense of security from that clan self odour, plan odour. So if it's something that the owners brought along with them, then that's better. I know we've got to be a bit careful with COVID at the moment because of inanimate objects perhaps carrying infection, but it's going to be very difficult to completely erase that risk, because the animal themselves may have. So hopefully with our PPE and with good hygiene, hand hygiene, that we should mitigate that as a possibility. But yeah, tell the owners to bring a bit of clothing for their dogs if they're going to be staying in for any procedures, or even just for the examination. It may just be an examination that come in for. So yeah, pheromones are going to be quite useful in the environment, as well as on anything that uses covers. But yeah, owner's own clothing is a good idea. So I'm going to see who else is here. I've got a few more. I don't know if I scroll down on here and see if I can see anybody else. But yeah, there's quite a few people here in the room, so that's great. And it might be nice if hello Nat, I'm going to be speaking to you tomorrow. And Elaine, hello, and Claire, and quite a few people that I know, and Tommy, and people that are familiar, but people that I don't know, which is lovely. So great to meet all those new people. I don't think I've got any questions yet. Hang on a minute, I'm not used to this. I'll just see if I can scroll down and see. I did a post for oh, fantastic. I did a post for our practice Facebook page last week using the Dogs Trust infogram. Brilliant, Debbie. Yeah, I thought it was really a good idea, and started habituating my dog to the mask. Fantastic. That is brilliant. Yes, and somebody else has said the same with hand sanitizers. That's a really great point. Thank you, Vicky, for that. That can be a bit of an alien smell. I mean, the whole smell stuff in the vets is always a bit of a problem, unfortunately. You know, when I've been working there, I come home stinking as well, of clean things as well as not so clean things. But but yeah, hand sanitizers, it's a really good idea to just get them used to that. That is a really great idea. Yes, I think I have got a question. Okay, Nicola, if a dog which is anxious about being separated from their owner has to stay overnight, is there anything the owner or the vet practice can do to make things less stressful? That's a really great question. Thank you very much for that. Yes, for the owner, perhaps bringing something that's got their scent on it. That makes a big difference. I think also I'm probably going to include dog and cat in this as well. But thinking about perhaps if it's a dog or a cat that's got real anxiety, real problems with anxiety, it's definitely worth speaking to the vet about, because it's possible that they may be able to give you something, prescribe something to just take the edge off the animal. So, you know, it might not be appropriate, but it's worth that conversation. There's nothing wrong with saying to the vet, you know, my dog, my cat really does get stressed out, and it's going to be an even more stressful situation if I can't come into the building with them, or whatever. So Jay, just ask the vet about that. It's worth having that conversation. But familiarity in terms of scent, and I know we sort of talk about scent an awful lot for cats and scent exchange, but dogs have got an incredible sense of smell. So the idea really for me is that if they've got such a great sense of smell, then perhaps we ought to be using that. And I don't think it's a bad idea to send them with clothing, or scent cloths, as we would with cats. I think that would definitely be a useful thing to send the dog along with. So a piece of clothing, but also if you put some scent cloths, when we with cats we usually tend to do that sort of around the facial area. But something that they've been laid on, the dog's been laid on a cotton blanket or something, sheet should I say, and putting it into strips and putting it in a Tupperware container, so it keeps that scent, as we would with cats. You know, it's not going to harm, and as I say, with dogs having that keen sense of smell, then it's going to, that familiarity might just give it an extra comfort. So yeah, do speak to the vet about the fact that if they're anxious, they might make you feel a bit happier if they say, well, don't worry, you know, we're gonna we can use something that you can collect, so that the dog arrives in a lot less stressed situation. But also, it's worth speaking to the vet, because what they might do is potentially give the pre-med to the dog whilst he's still in the back of the car, if it's doable, so that there's not that struggle for the dog coming through the car park without the owner. And sometimes owners feel a lot happy about that. I mean, just normally some clients in situations that I've been involved with would rather not leave the dog until the dog's feeling a little bit woozy. So there's nothing wrong with asking, could we have the pre-med while we're here, just so that I know that the edge is taken off. Sometimes it just makes you feel better as well as the animal, of course. So if it's possible, it's definitely worth having a chat with your vets or the veterinary nurse, because often they can allay your worries in that sense. So that is a good question, Nicola. Thank you. See what else I've got. We have 3 failed vaccination attempts today. Oh dear. Is that, well, I'm asking a question we can't answer straight away. I know there's a bit of a time lag, but presumably that's because the dog was so stressed about not being with the owner. I think the thing is, it's always a good idea to know when enough is enough, and it's sort of not really a failure not actually being able to carry out a procedure. It just shows that actually you're doing the best thing. You're backing off and letting that individual, just the heat can be taken off, because in a lot of situations, if we're really sort of pursuing an animal, then that's just going to make them worse in the long run. So yeah, I wouldn't see that as a failure on your part. In fact, it shows, Debbie, that you're doing a great job. It's always very, very difficult, because obviously at the moment we can't arrange those sort of rehearsal visits either. But yeah, just I mean, obviously once restrictions have been lifted, I think that sort of desensitization, counter conditioning program that a lot of vets run is a really good idea. The difficulty with that is that if a dog is so frightened, I mean, we often say that, don't always think that sometimes that dog may be so, or cat, may be so fearful of the vets that actually we've not got a really good starting point for desensitization. The fact that they're actually coming to the vets is just flooding them. So again, it might be worth having a conversation with the vet about medication, just so that you've got a good platform to start at for desensitization and counter conditioning. Laura, any tips for making cats and dogs feel at ease in the consult room when the owners can't be present? Yeah, my practice still isn't allowing clients in. Yeah, I think it's a lot of it's that scent. I think in an awful lot of cases it's not rushing in. That we talked about with cats, that sort of covering of the carrier. But if you can let the cat get out of the carrier itself, I know working in practice sometimes when you're busy, it's actually that physically getting them out of the carrier or dragging them out of the carrier that can be really off-putting for a lot of cats. So for cats, letting them, giving them time to actually come out. Often they'll sort of pop their heads out and case the joint before they slowly emerge. And actually, it's that sort of thing that can make all the difference. I think also comfort, sometimes coming onto the veterinary consult table, the texture of it, it's cold. In most cases, vets tend to put a non-slip surface down, but even so, it might, not be very comfortable. So laying something comfortable on there. Actually, often if you say to clients, bring their bed with them, and then the cat's got somewhere familiar to go to, that might be a good option. But with the carriers that open up, I think if you were advising a client, might be better, because then you can open the top and the cat can just sit in that little section of the carrier and get a sense of security because it's in it. But again, having towels can help, because if you can sort of cover their heads, it's that sense of if you can't see me, I can't see you sort of thing. It's that security. So that's definitely something that I would advise. I mean, one of the things about the COVID thing is that actually the waiting rooms are quieter. So there are some good things, because often animals come into a waiting area and it's busy and there's lots of unfamiliar sounds and a lot of unfamiliar scents, and that's the sort of place where that sort of trigger stacking can begin. Some it's the car journey and being in the crate. The other thing, of course, for owners is to advise them again through social media about crate training, carrier training, because for cats a lot of the sort of the initial upset is being pursued in the house and being put in the carrier. So I would definitely advise that clients are given good advice, and I often would say that seeing a video demonstration is a really good idea, because as much as we can give out a handout or tell people to do it, in many cases they don't do it very effectively. So I think a visual aid is a really good idea. I'm putting together a short video with all the main points on my website and on my YouTube channel in the next day or so. So if you want to find out where that is, obviously you can just message me about that. That's absolutely fine. Right, I better get having a little look down here, and because there's quite a few questions coming in. Hope that's been okay, Laura. I think, there's lots of other things you can do with the pheromones. Classical music, there has been some evidence to say that sort of background music can help. This generally now in a waiting room, as much for the clients as it is for the animals. So if the owners are feeling fairly relaxed about things, then obviously that energy can be transferred to the pets as well. So that's a nice tip. Tommy, since there aren't any puppy classes going on at the moment, how can I start to train my puppy to not be scared of the vets and other animals? I realise it's one of the most important socialising tests. It is, yes, and a lot of people have asked the same questions. There's quite a bit of information out there on puppy socialisation on the APBC website and beyond, but certainly in terms of this sort of COVID situation and bringing the puppies in, I think it's having the conversation with the vet, making sure that they're aware of that, speaking to the nurse. I think those of you that are nurses, perhaps, and I'm sure you do this already, just speaking to the client and allaying the fears and saying, yeah, we know that your puppy's not been to the vets before, but we're going to make it as pleasant as possible. I think taking treats that your puppy really enjoys is a good idea. And again, a tip for the veterinary personnel that are here, maybe saying when you're booking an appointment, will he bring his absolute favourite treats with you? This is not just for puppies, this is for all dogs, but particularly puppies, we want them to have that first experience of the vets. We want it to be really positive. And as I said earlier, in some ways it is positive, more positive, because the waiting room's a bit clearer and it's a bit quieter. But still, we want it to be a positive experience. So yes, ask the nurses if they can bring in a piece of clothing with your scent on it, Tommy, would be a good idea. I think also what you can be doing at home is habituating puppy to being handled, looking in their ears, lifting up the paws, getting them ready for maybe later on when they might have the nails clipped, just by putting a little bit of pressure on the nails, just with your finger, just so they get used to that sensation. So all of those potential things that's going to happen in a vet's, being restrained, looking in their ears, looking in their eyes, those sorts of things are a really good idea, so that your puppy gets used to that happening in the home, not just at the vet's, but then it's not an alien experience for them when they do come to the vet's. The other thing that you can do is just lift a little bit of the skin around the neck. Obviously you're not going to be putting any pressure on there, but just getting hold of it, because that's often where the vet will lift the skin to put in an injection. So just getting them used to that's a really nice idea. But yeah, as I say, have the conversation with your vet. Sometimes just and nurses, I know, are very, very approachable, and so are vets, but often it's the nurse that you see first of all, and just have a chat with them, and make sure you have a chat with them, because as I said earlier, if you are speaking to the nurse and puppy or adult dog is seeing that engagement, then they tend to relax a little bit better too. So yes, one tip that I like is paper plates made with a bit of cream cheese or pate or something, and get your puppy used to having that at home, and then saying to the nurse, would you mind taking this in with you, because my puppy really likes sort of licking the plate, and puppy then immediately as it sees it goes, oh, I know all about this, and I always feel great when this happens. So it's just making sure that we've got those positive associations going. So as an owner you can do that, as a vet nurse you can advise clients to do that. So I think that's quite a nice little tip. I think the thing we've got to be careful about, I better not go on too long on this one, but popped into my head, is that whenever we're using treats, it has to be timed well. Oh, so sorry, we're having trouble with playing this video. Can anybody still hear me? Are you there? Is anybody there? Because I've just got a message up on my screen that says, sorry, we're having trouble with playing this video. Will somebody tell me whether we are there? I'm not sure if you are there. I might carry on for a minute or two. But yes, it's sort of saying that we're having trouble. I might just message somebody. These things always happen to me with technology. Right, let's just see. I'm just gonna message somebody. Let's have a look. If you are there, it'd be nice to know if anybody is still there. You were still here a minute ago, still there, still, yes, it's fine, that's fine. It just says on my screen, sorry, we're having trouble with playing this video, but obviously you're not having trouble seeing me. You're fine, it's playing. Thank you, thank you, thank you. Everybody's messaging me, that's really kind. Thank you. So, sorry, I've forgotten where I was now. I think I was on the paper plate thing, wasn't I? Yeah, everybody said it's okay. Thank you. So yes, I like the paper plate thing, but yes, I know what I was saying. Timing. If you time to give a treat to the puppy just as the injection is going in, then the timing may then not work, because what you're doing is you're timing this treat, this thing that they really liked, now with something that's painful. So just that's sort of something for the veterinary team to think about. Well-timed treats is the key. So when puppies, licking the plate, and you just want to make sure that they're actually engaged in that, and be lifting a bit of skin before you actually put in the injection. So yeah, well-timed treats is something to bear in mind. Right. Oh, Rachel's here. Hello, Rachel. That's nice. Rachel Bean. Hello. Yeah, often the client drags the cat out and you have to stop them politely. Yeah, absolutely, you do. So yeah, let me see, because I think I sort of scrolled down to make sure I was still on. Yes, yes, stressed dogs, but yes, agree. We backed off at the right time. You did, Debbie. Absolutely, definitely. Okay, let's have a look. Any tips for 9-week old boxer puppy who keeps biting and jumping up and growling? That's a sort of more specific behavioural problem. So I might not be able to answer that here tonight, because we're looking more at the sort of the veterinary thing, but he still has to wait until next Wednesday for his second jab. Not sure. That's sort of more a training thing. So if I can, if you want to message me privately, I can see if I can help you with that. I've just been told that I need to stick with the remit tonight, which is that sort of veterinary visit thing, Laura. But certainly he still has to wait until next Wednesday for his second jab. Not sure about the garden for him. You should be able to, if your garden is well fenced off and the boundaries are safe, you should be okay in the garden. So I wouldn't worry about that too much, as long as I say, that nobody can come in and he can't get out. And that's quite useful for that socialization that we were talking about earlier. You can introduce him to different textures, grass, different textures that he stands on, soil, all sorts of different things that are in a garden that a puppy needs to socialize to. So yes, don't keep him in the house solely, because it might just affect his socialization a little bit. So yeah, lots of experiences in the garden are fine, as long as it's safe out there and nobody can get in, and obviously you can't get out. Let's have a little look. Anything else here? I think I'll just scroll down, make sure I haven't missed anybody. Oh gosh, there are a great few. Yeah. Yes, somebody says that paper plates to train puppies to stand and target the cream cheese plate. Claire, brilliant. Yeah, so you're doing that in your training, and that's a really good idea for people that are trainers, maybe to think about that, and then that goes with the with the puppy. Nicola, surgeries are now even more scary in terms of scent, and this could be a problem for the relationship with another cat left at home. How might surgery overcome this? So surgeries are now even more scary in terms of scent, and this could be a problem for the relationship with another cat left at home. Okay, yeah, so you're thinking about their cats coming back from a veterinary practice with an alien scent. And then when they're being introduced to other cats in the household, that can be a potential problem. So yes, with scents, with disinfectants, I guess you're saying, and the hand sanitizers, that's a really good point. One of the things that I usually recommend owners that have got multi-cat households, or just 2 cats, and one of the cats has to come to the surgery, is when the cat that's been to the surgery comes back to the home, that you separate them for certainly until they've come round from their anaesthetic, but I'd say for the first 24 hours. So making sure that the cats both have got their own resources, but that they're separated, because it's really quite alarming for a resident cat to smell something alien on a cat that they have known and bonded with, because cats, the scent profile is so important that they recognise the cat and go, oh, I know who you are, but actually you don't smell like you did, and I don't recognise your scent, therefore I don't really recognise you. That can really freak out some cats. So that's certainly thanks for pointing that out and asking that question. But yes, generally anyway, regardless of COVID, that's something that owners of cats must remember, and certainly veterinary nurses, vets that are with us tonight, is something to just bear in mind as well, to give that advice to the clients, post-operative advice. So, paper plates. Okay, lovely. Thank you. Yeah, Laura sent a message. That's fine. Any idea when vet practices will open up again? My boss is my boy has separation anxiety and is anxious without me. Okay. So, any idea when vet practices will open up again? Most of them should be open. Some of the branches might not be open, but certainly my experience is quite a few are open. So if your practice isn't, I'm not really sure about that. But and has separation and is anxious without me. I'm sort of guessing. Lindsay, do you? Are you're an owner? So I'm not really sure what your question is about. My boy has separation anxiety, is anxious without me. I think you're probably worrying about when you go back to work after the COVID lockdown sort of restrictions, and you're worried about your dog in terms of separation anxiety. There has been one of these Ask the Experts all about separation anxiety. So I bet you there'll be some really great advice on there about that specifically. So head over to the videos and have a look at that recording. You'll find quite a lot of information on that. Hopefully that's going to be useful to you. But I would think your practice will be opening fairly soon. Yeah, is there something I can do to get my cat used to her carrier for when we go back to the vet? She's not a great fan of it, and it's always a struggle. Yes, you are definitely not on your own, Graham. That is a real problem for a lot of cats. They just skedaddle as soon as they see the carrier coming out. I think it's certainly in lockdown has been a really good time for owners to be maybe thinking about doing some of the training with the pets. For cats, cat carrier training is probably the best thing that you can do. There's been some research done recently at the vet school in Vienna that's showing that it definitely makes a difference to the whole veterinary experience if cats are desensitized or habituated to the carrier. It's a good time to start when the kittens, so that they just get used to the carrier being around and it being part of their normal environment. But yes, I think spending some time with cat carrier training is a good idea. There is, as I say, I've done a sort of series of videos to help with that. So that's something that you can access quite easily. I can put the link on later on. But yes, I would spend some time getting her used to the carrier. And if you haven't already got a carrier, I would definitely say the types of carrier that come into two are better, because then you can habituate or desensitize if she's already got an association, fearful of association with it. You can take it apart, line it with a nice piece of bedding, so that she may be interested in just sitting in the tray area of it. You know, it's quite scary seeing it as a carrier, but she might feel a little bit happier about going in it if you take it apart. Give it a good wash as well. I'm not saying that you're dirty, but if you give it a good wash, it won't have any of the previous smells on it. So it'll be and if you clean it not with anything strong, don't use strong disinfectants, just a good scrub with clean water is as good as anything to remove any residual scent that's there. So yeah, it's quite a detailed process, but it's definitely worth spending time doing that. Right, okay, yes, thank you. Somebody's put on there for Lindsay the separation. Yep, goody. Okay, so Laura, yes, I think there's some information on there about getting in touch. So yeah, so restricted access for okay. Exactly, restricted access visit where I leave him at the door. I see, I'm with you. Yeah. So what you're saying is that he's worried about being separated from you. Just spend a little bit of time, as I said, chatting to the vet nurse, chatting to the vet. But if he really is anxious, it might be worth having a conversation with the vet about giving him something just to take the edge off if he's really separation anxious. So that's something, Lindsay, to do too. Let's have a little look, see if I've missed anything. Let me look. I think. Am I down at the bottom here? I think I might be. Other things that I've said on here, I've put some little notes on as well. I've done that bit. Health and safety. Covers for cats, I've done that bit. Familiarise your dog. Yeah, eyes, be careful of the eye contact when you've got your masks on, vets and vet nurses. Peripheral vision is always a good idea. The other thing that I think is a good idea is how we approach animals. So I'm always banging on about this at the veterinary practice, but when we first meet an animal, again, just being aware of our position of our body so that we're not sort of looking threatening. So a little bit more of a closed body posture. And I think in the kennel area as well for vet nurses. Sometimes I know I've been there, you know, you need to get a patient out for a procedure. Just going to the kennel door with a closed body posture makes a huge difference to just walking straight to the kennel door or the cage door, the accommodation door. So just bear in mind that sort of body posture as well. That's a really good tip. And talked about treats. Also, within the practice, just get lots of different treats in, because remember, we might have one type of treat to use to help a dog particularly, and that dog might not like those treats. So getting, you know, so different varieties of treating, then you're bound to, you know, hit on the right one. And cats also, you know, if you've got some pasting, you can just put that down on the table. Doesn't exclude cats as well. Some cats that are quite food orientated will feel a lot more positive if there's food around. So bear that in mind as well. So anybody else got any tips? Tips. Well, you could have a really great tip for me. Have I got any tips that I can give you? Let's have a look. Let's have a look. There we are. Are there any particular tips for preparing a puppy who arrived during lockdown and is used to having constant company for being left when the owner returns to work? Yeah, and I'm guessing that sort of in that. Yeah, I think we've got. I don't know whether we've already done a video Ask the Expert on that one. But that's sort of the part and parcel of this sort of separation anxiety. So I'm guessing there'll probably be some really good tips on there as well. So I'd have a little look at that, Nicola. About that sort of separation anxiety. But yeah, it's pretty much making sure that we get our puppies used to isolation, being isolated for periods. We want to do that really gradually. Obviously, if they've been used to the owner being with them all the time, and then suddenly the owner's going to be leaving them, we could be setting those puppies up for failure and for problems in the future. So I think it's a really good idea to make sure that, you know, from regularly from time to time, leaving the puppy in another room while you maybe make a cup of tea, or baby gates are a good idea because that's that halfway house, so that you're not leaving them completely behind a closed door if they've never been used to that, but gradually getting them used to not being with the owner and shadowing the owner all the time. So that's definitely something I'd be advising, just so that you're beginning to habituate the puppy to some time on their own. But I bet there's some really great tips on the video that's already been done for APBC. Any tips for staff getting dogs out of cars? That's a difficult one, isn't it? Because obviously the dog's like, no, I don't want to come with you, because you know, you represent something scary, particularly with our uniforms on and all the scents. I'm just wondering how it. There might be, depending on obviously. I dare say that it's going to be really difficult to get the owner to get the dog out, because you've got to then get near the owner to get the dog. I think it's really, rather than us pulling them and facing them is a bad idea, approaching them side on, as I said earlier, not making eye contact, using a bit of a jollying along, come on then, you know, that sort of thing. I think a tone of voice makes such a difference, and I'm probably teaching Granny to suck eggs. Veterinary nurses know this, but probably that sort of body posture would be something to bear in mind. Just thinking about where you are in position with the dog in relation to the dog. Um, so that's definitely something I'd be thinking about. It's going to be a bit of a difficult one. I always think, sort of dragging a dog out of the car is just not the right way to go about it. But just nice even pressure. So rather than pulling, just nice even pressure. And as they come towards you, just that bit of praise and maybe doing it a little bit, like I said earlier. Sometimes it's knowing when to back off and just saying, okay, he's just feeling a little bit uncomfortable. Just going to chat to you for a little bit longer because he doesn't know who I am. Probably just taking that bit of time. But it is, unfortunately, yeah, it's a difficult one. One of the vet nurses might have hit on something and said, I did this and it worked really well. And if you do, please come on in and say it. Right, what else have we got? Hopefully that's been useful, but it is unfortunately at the moment a bit of a problem, us getting them out of the car. Any more? Oh, thank you, Catherine. Good tips. Thank you. What else have I been thinking of? There's lots and lots of things just generally. I'm sort of thinking more sort of COVID really at the moment, but it's the whole thing. It's just taking time, and one of the things that I also think once we're out of the COVID situation is, or even within the COVID situation, let's say if you're bringing in a cat in a basket and there's a bit of a delay between it going into the consult room, just make sure that you're aware, you put that somewhere high up. Cats like to be elevated, they like to be in a high up situation, so rather than on the floor waiting for the vet, put them in an elevated location, obviously still covering them, but they've just got that sense of being raised. And that's just generally within a veterinary practice, making sure that you can utilise that height. Really good sturdy bookshelves can be quite useful. That you don't want the cats to obviously be able to see other cats, but benches in your practice, even seats, as long as they're sturdy. And the other thing as well about the whole thing about getting the animal to the vets, in COVID sort of territory or out of that, is thinking about the journey and speaking to the clients, maybe just doing something on your social media to make people think, because just slowing down and going around corners a little bit more cautiously and carefully. The trigger stacking often happens on the journey to the vets, so we've talked about sort of thinking about desensitizing cats and habituating to carriers, but even to the car journeys, that's for dogs and cats. So thinking about making it a comfortable experience for cats, making sure that they're properly strapped in and that they're not being sort of jilted around, and that's quite important. And actually telling owners to put quite a lot of bedding in the carrier, because then the cat's a little bit more wedged in, and they've not got as much space to be thrown around. So those types of tips help. And I thought of something else and it's gone. I know what it is. We talked about cat carriers and how we can use the time to habituate, counter condition, desensitize cats to carriers. But also the other thing is, if there is a client whose dog perhaps has to have a regular procedure, let's say they have to have the nails clipped regularly, and that dog always, this is for owners as well as for veterinary personnel, if that dog usually always has to have a muzzle put on, it's going to be far worse that dog having to be muzzled, perhaps when it's primary carer or the owner's not with them to hold them. So I think it's a really good idea to spend time as an owner and as a vet nurse to perhaps advise the owner to muzzle train their dog. And a lot of people don't always like to do that, but again, videos can be really useful, especially if you've seen a video where there's a dog that's sort of happily putting the nose in it, like my dog does because she wants to get the cheese. But if you've got some nice video footage to show them, again, I've got a video on that just shows how pleasant an experience it can be, then it's definitely worth speaking to clients about trying to encourage them to muzzle train their own dog, because if they come to the practice with the muzzle on, or their owner puts it on for them before the vet appears, then it's going to be a much more positive experience for them than it is if the vet and the nurse are having to grapple the dog to try and get a muzzle on them. So muzzle training, and one of the times that I think people are more open to that is at puppy parties. So those of you nurses who do puppy parties, I definitely think it's worth incorporating muzzle training into the puppy party sessions. And the way I get around that often to try and make people see it more positively is to say that, you know, I teach first aid and it could be a lifesaver. You know, if your dog's bleeding to death, you need to put on a pressure bandage, but they're nipping you because it's painful, you know, putting a muzzle on could save its life. And usually that's the clincher. Then people will think, oh yeah, it is a good idea to perhaps muzzle train, perhaps they'll have a go at it. So muzzle training, owners being able to do it themselves, makes life a lot easier for everybody. So that's another one. Right, let's just see if I have got any more questions. Okay. Could there sometimes be a negative association to a particular treat? Yes, there could, Claire. Good tip. Could there sometimes be a negative association to a particular treat if you use the same one every time they visited the vet? Yes, that's a really great point, Claire. Yes, there could. And actually in cats, we know that sometimes if we give a particular prescription diet, say for example, in the practice when they're ill, they might not take it when they get home, or they might have an aversion to it because it reminds them of those negative associations. So yes, absolutely. So we need to be aware of that. That's one reason why with any pet, but certainly in that socialization period, it's also about getting them used to different textures and types of food, so wet foods and dry foods as well, just in case you ever have to give them a prescription diet that's only available in a wet food. So getting them used to lots of different types of texture food wise might be a useful thing in to incorporate in that socialization habituation period. But that's a really good a good point, Claire. Yes, and that's what can happen with poorly timed treats. So it's definitely something worth bearing in mind, and it's a really important point you raised, so thank you for that. Yes, that could happen. Any tips for vet staff getting the dogs out of the car? I've done that one. Let's have a little look, see what else is in here. In our practice, owners are getting dogs out of the car. Good. We chuck owner along line, and they clip it on. Then we take this. That's brilliant. Thanks, Charlie. Fantastic. That's a really good piece of advice. So if you can't see that, so Charlie's saying in the practice where they work, owners get the dog out, and then they're given a long line. I mean, you could even perhaps have some long lines in a bucket that the owners go and get, and then once that's been used, then that's disinfected, ready for the next time. Brilliant. Thank you. That's a great tip. Thank you. So hopefully you've all got that. So yes, that's a brilliant idea. Why didn't I think of that? Well, I'll remember it. As dogs and cats probably have seen less visitors than usual, so how can the experience be broadened again in a controlled manner? Again, that's probably part of that sort of socialisation situation. So we're looking primarily at that sort of stressful situation in the veterinary practice, but certainly I think from a veterinary perspective, we want to make sure that that their experience of seeing the veterinary personnel is as positive as possible. So it's a matter of the whole experience of the vets being as positive as possible. So yeah, just those taking time, backing off, thinking about that closer body posture, owners thinking about bringing familiar scents with them, owners thinking about, I mean, there's no reason why during lockdown dogs can't be still seeing people from the garden, provided it's safe, seeing people through the window and having those positive experiences whilst they're seeing a number of different visitors. So in some ways it can work better because it's more of a controlled meeting of strangers and people. So in some ways, it's more controlled because of the COVID situation. So that is one of the benefits, I suppose. Blue Cross do a great muzzle training video. Yes, they do, Catherine. It's a great one. It's on my website, a link to it. So yes, there is one there. So that is a good one. Thank you. Dogs normally get 6-month healthy checks, but not had since November. 7-year-old beagle in the last few months seems quite lonely and depressed because he's used to being at daycare with lots of doggy pals. Can I cheer him up? Well, I think the best way to cheer most dogs up is to give them that sort of natural endorphin fix. And for most dogs, beagles particularly, probably giving them something to smell. So a little bit of scent training might be good for that. The go find, so giving the feed in a bit more of an interactive, fun way. That's a nice idea. I often like the idea of the plant demister with some sort of bead stock in it. You'll have to water it down, otherwise it might get clogged up. But spraying that around the garden and with a few little treats sprinkled on top and helping them find it. And then eventually you can sort of ask them to go find. I usually like a nice little cue, like go find. And every time that I'm getting the noses down, the go find becomes that cue to get the nose and have a sniff. But scent training, you can eventually then get rid of the treats off the scent, and then they'll just have to find the scent themselves. Scent training, interactive games, play has been shown to help dogs feel better, just in the same way as it does with us. So lots of those activities that you can hopefully get going in the house and in the garden if you're a little bit restricted to where you can go at the moment. But that's a really good way of getting positive endorphins flowing. So hopefully that will make your dog feel a bit better, Michelle. So try that. But yes. It's probably the fact that he's just not as engaged at the moment. So if you can try and engage him in other ways, that might be good. What else? Okay, Laura says we're currently asking our clients to put their dogs on a dog park at the front door. Then we collect them once the owner is backed away. Oh, I see. Okay, that's another good idea. Thank you. So this is something that's another idea that practices very ingenious. Thank you. Great. Jessica says yes, it's massive help when owners bring reactive dogs in already muzzled. Yeah, absolutely. So much less stressful for the dog, the owners and the staff. Yeah, it really, really, really is. And if we can just persuade owners to do that, then yeah, that does make a massive difference. I haven't found a negative association with a particular treat in dogs other than once when the timing was out and the treat was given just as the injection started stinging. Yeah, that's its timing is definitely everything. Owner giving us the dog is my preference, but our practice seems to have changed to getting the dog out themselves. I'll try them with the long line idea. Good, yeah, I think it's a great one. Thanks, Caroline, says Claire. Really great tips. We'll definitely add PPE equipment to my puppy training classes. Good, yeah. I tell you what else I would do, just in case. Most vets use the sort of see-through gloves, but I have seen some using the blue ones. So I think the blue ones probably aren't a great idea, but it might be worth letting them see blue ones as well, just in case anybody is using the blue ones. So thank you for that. And sure, I wrote something else down. I've got lots and lots of tips, but they're all over the place. I'm trying to look here and look there. The layout of the waiting room is really important. Once everybody gets back to normal, that's something to bear in mind. Receptionists are the most incredible people in the building because they are the shop window of the practice, but also they're the first point of call for the animal and for the owner. So and often the receptionists are the ones that are managing that reception area. So so those of you who are working in reception, think about sort of the layout, making sure it doesn't get too stuffy. A lot of stress pheromones in a small space. So sort of good ventilation. Obviously we've got to be careful with windows open and things like that, but you can get some quite good ventilation systems quite reasonable. You don't have to have aircon. If you've got aircon, fine. But yeah, those sort of smells. Getting the animals, particularly as I say, if you've got a stressful animal, it might be worth them staying in the car. And for some of the stressful pets that we've got, actually being in the car might be helping them. So the COVID thing's not all bad. But yeah, if you notice a dog or a cat that's stressed, or an owner that's stressed, putting them in a quiet room to wait, everybody just calms down. The other thing that sometimes I'll notice at a reception area is round the desk is a bit of a hub. There's dogs and there's cats and there's rabbits and there's people with it. As a receptionist, it's really important to just think, well, hang on a minute, this is getting a bit busy around this area. Obviously not at the moment, but once things go back to normal, so it's managing that area. So, I mean, you can do that staggering your appointments, and to a certain degree, if you know that you've got on your appointment list a prey animal coming in, then it might be worth sort of thinking about where you might put that in terms of your appointment system. You don't really want a cat coming in at the same time as you've got, a rabbit coming in, for example. So the reception area is like this vital little hub. So any receptionist or people working on reception, you're doing a fantastic job. But just think about, that area and managing it is a really good idea. Right, have I got any other questions? Let me have a little look. We must allow boy if he's going to have injection procedure, but if it's just a routine visit, we have a fantastic vet who knows our boy is happy being examined on the floor. It's a really, really good point, Michelle, because what I do think sometimes is that I've seen lots of great vets where they will actually get on the floor, and cats, going back to cats, not just dogs, will often get out of a carrier themselves, and they'll jump down and they'll want to sort of like have a little sniff around the floor. And a lot of vets will often then sometimes just sit on the floor, and the cat will sometimes just sit on their knee, and then that examination can be carried out without too much sort of hands on. Sometimes just going on a table is like, oh my god, I'm on this table. So it's great if you've got a vet that's just very sensitive to that. And yeah, he licks the vet, so there you go, that's really good. So yes, it sometimes is, and there's nothing wrong with saying as an owner he prefers to be examined on the floor. I've often found that he's so much better on the floor, then that sort of almost tells the vet. So don't be frightened to have that conversation. Vets and vet nurses, in my experience, having worked with them for a long time, very open to suggestion and very, very open people. So don't be frightened to tell your vet what your animal prefers, because you are the best judge of that. You know your own animal, so don't be frightened to do that. Do you think movable screens between cats and dogs in the waiting room are helpful? I do, yes. That's one thing that I talk about a lot. It's very difficult to have separate waiting areas unless you've got a big waiting room and the waiting area is set out that way. But yes, you can get movable screens. One of the practices that I work at, they have a wooden sort of movable screen that they can sort of move around. I tell you what works really well too. They don't always go right down to the floor, but the brilliant in wards are the old-fashioned screens that you used to wheel between beds in the hospitals. You can still buy those, and we have those in the kennel area as well. So we can actually put those in front of accommodation to just screen off a patient, so they can work well. I mean, obviously towels and things like that, but yes, I do think the screens work well. We've got a screen through Royal Canin purchases, brilliant. So we could create a separate cat and dog waiting area, fantastic. So if you can get one and you use Royal Canin food and you get a freebie, then great. But you can make your own. Joiner did one at the practice where I am, but then we did buy the hospital screens as well, and actually they work really well too at puppy parties, because if you've got a puppy party and you see one puppy is just feeling, you can notice its body language, it's feeling a little bit distressed. Obviously if it's really distressed, you want to take it out of the scenario altogether, but sometimes just having a screen around one that's perhaps a little bit less confident might be a good idea, and those movable ones are great for that. So yeah, screens, love them. What else? If I have if I have a very anxious dog patient, no matter where examined, I will examine on the table so he knows what will happen, and allowing him off the table is used as a reward. Yeah, and if that works for you, that's fine. But definitely some animals are much better off the table. But Catherine, if that's something that's your experience, then by all means continue. But yeah, I think it's a good idea to just see what works best for you and for the animal. But yeah, good, 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 good. Thank you. It's really lovely that people are coming in with their ideas as well, because you're all, many of you here tonight have got your own experiences, and I think this is what these sessions are about. And whenever I'm doing any interactive sessions, I learn lots as well. So thank you for that, everybody. It's great to hear your experiences. So thank you. That's grand. So let's just have a look, see if I've missed anybody. Oh, I agree. I go through lots of knees in my trousers, always sitting on the floor. Yeah. Actually, that's not a bad idea. Perhaps those knee pads are a really good idea, that builders have. Never thought about that, but perhaps we should make that veterinary nursing kit. I think that's good. So great tips to take back to practice. Thanks, Caroline. You're very, very welcome, Laura. Thank you for coming. I have been here an hour now, and I don't know whether or not somebody's going to get a hook and hook me off, but if there's any more questions, I'd be more than happy to take any more questions. But I'm guessing we've sort of covered most of the questions that you've wanted answering tonight. I know what's going to happen, because we're going to end this and I'm going to think, oh, I should have mentioned that, or I should have mentioned the other. So for those of you who take companion animal, the veterinary journal, I'm writing something about do's and don'ts for cats in practice to help the experience much more positive for them. So that's coming out, I think, in the June edition. So have a little look out for that. Thank you, Joe, for saying thank you. That's lovely. Pleased that you enjoyed it. Lovely to have you with us tonight. Yeah, that's great. It's been helpful. Thanks, Catherine. Yeah, that's good. And thank you for your input too. And all the questions have been fantastic. So thank you. But yeah, I know what's going to happen. I'm going to go, I wish I'd mentioned that. But never mind. Hopefully we might do another one, and perhaps once COVID is over, we can maybe concentrate on other areas. So that's grand. Thank you. All these lovely thank yous. Thank you. Thank you. So yeah, I suppose I ought to go now and let you all go and get your supper or to bed. So thank you. So I'm Caroline Clark. Those of you who came in late, I ought to say who I am. Caroline Clark, veterinary nurse, behaviourist. And hopefully I've sort of shared some of the tips that I've acquired throughout the years, marrying them together with the behaviour. So thank you. You will have to do another one, says Claire, if I've asked. Anyway, we can post any further information on our page. Says the Association of Pet Behaviour Counsellors, so that's grand. So lovely, a sequel. Yeah, I hope so. Part 2. So lovely, thank you ever so much. And I'm going to press the end button now and go and have a cup of tea and lie down in a dark room with a flannel over my head. Anyway, thank you. And hopefully I'll meet some of you face to face in the future. Managed to finish in time to get on. Thanks for the live. Lovely, Charlie. Thank you. And thank you for your tips, and thank you, Graham. Yeah, thank you. So, and good night.